there isn't a bigger change that I can make in someone's appearance than when I change their nose. Rhinoplasty and contouring the nose is the biggest structural change you can make in someone's appearance. And patients will often ask me, are people going to notice? What are people going to say? I want you to change it a little, not a lot. I want to preserve my identity. And it's interesting. Sometimes the largest noses with the biggest bumps that we reduce and really make fit the form of their face gathers no attention. Family doesn't notice, and friends don't notice, and they just say, there's a gestalt. They say, gosh, you look better, your hair looks better, you have new glasses, or something like that. And the patients come back, and sometimes they're even disappointed, like, why aren't people noticing? And it's an interesting phenomenon. And primarily, when you do a nose, the part between your eyes rarely changes. And when people talk to you, they make eye contact with you. So they're focused on your eyes and the bridge of your nose between your eyes. They're not looking at the tip of your nose. They're not looking at the bump on your nose. I mean, you are in photographs, you are when you look in the mirror. But that part is not in other people's head. Now, if there's a patient who's thinking about having their nose done and their nose fixated and they're looking at everybody's nose, they're going to notice it. But in reality, if you change the nose in a natural way so that it fits in with the form of their face, it goes more unnoticed, and that's the goal. Even when you have a large nose and you're making it smaller and you're taking a bump off, the goal is to create something that blends in, is natural, and for that reason is not noticed as much. When certain surgeons do rhinoplasty, they treat the nose as if it was in a vacuum. So for example, they will do the tip first, and then wherever the tip ends up, they take the dorsum or the bridge and make it match the new tip. Well, the reality is that the bridge of the nose and the dorsum has to match the face, and that's where you should start. And if you start that way, you're going to end up with a much more natural nose. You can put the tip anywhere you want to match that bridge, and if the bridge matches the face, that is, matches the chin, the forehead, the cheekbone structure, then everything is going to fall in place, and it's like dominoes. And so when you see someone and they've had their nose done and they look radically different, there was something that was disrespected along the way. And I think that it really is easy in this case to really get a result as long as you, one, conform the structure and the contour of the nose to the face. That's primary. And the second is to remember that what's between the eyes is really the only thing that other people see.